At 94, strength may seem like a memory, but it doesn't have to be. Your legs, the pillars of your independence, can stay strong not through intense workouts or costly therapies, but through the quiet power of essential vitamins. These nutrients, often overlooked, fuel your muscles, protect your bones, and keep your steps steady. Aging doesn't mean surrendering your strength, it means nourishing it smarter. Number 1. Vitamin D, the muscle protector. As we grow older, one of the most silent but significant threats to our independence is the gradual weakening of our muscles, especially in the legs. Many seniors believe that this decline is simply a natural part of aging, something that cannot be stopped or reversed. But emerging research shows that a large portion of this muscle deterioration is actually linked to a lack of vitamin D, often referred to as the sunshine vitamin. Vitamin D plays a critical role in maintaining muscle strength, balance, and coordination. Without it, the fibers in your legs become weaker, your reflexes slower, and your stability compromised. What's particularly challenging for older adults is that the body's ability to produce vitamin D from sunlight diminishes with age. Add to that a more indoor lifestyle and limited exposure to direct sunlight, and the risk of deficiency increases dramatically. This deficiency doesn't always present obvious symptoms at first, but over time, it slowly erodes leg power, leading to stiffness, unsteadiness, and even frequent falls. Seniors may feel tired even after short walks or have trouble rising from a seated position. The legs may tremble slightly, not from age itself, but from vitamin D-starved muscles crying out for support. Vitamin D is also essential for calcium absorption. Without sufficient vitamin D, even if you consume enough calcium through food or supplements, your body struggles to put that calcium to good use. The result? Weakened bones, increased risk of fractures, and reduced physical confidence. It's like building a house with bricks but no cement. Eventually, the structure can no longer hold itself together. This is especially important for seniors trying to stay mobile and independent. The link between strong bones, active muscles, and vitamin D is undeniable. Thankfully, vitamin D supplementation is easy and affordable. Many doctors recommend daily doses of 800 to 2000 IU, depending on your needs and current blood levels. You can also increase your intake naturally by spending time in the sun, ideally 15 to 30 minutes a day, without sunscreen, on your arms and legs. Foods like fatty fish, fortified dairy products, and egg yolks can help too, although diet alone may not be enough for most elderly individuals. There's something beautifully powerful about regaining strength in your legs after feeling unsteady for years. Seniors who correct a vitamin D deficiency often report being able to walk longer, rise from chairs more easily, and even sleep better due to reduced nighttime cramping. It's a small nutrient with a massive impact, and it may very well be the key to preventing one of the most feared aspects of aging, losing the ability to walk on your own. Strong legs mean freedom to visit loved ones, go shopping, stroll in the park, and simply live without fear of falling. By investing in your vitamin D levels today, you're not just boosting your strength, you're preserving your independence. This is not just about health. It's about dignity. Number 2. Vitamin B12, for nerve and energy health. Imagine trying to walk across your living room, but every step feels unsure, like your legs aren't receiving the right instructions from your brain. You feel tingling in your calves, a strange numbness in your feet, and sometimes even a sense of dizziness when you stand up. These are not just symptoms of getting old. They could be the signs of a vitamin B12 deficiency, one of the most overlooked causes of nerve dysfunction and mobility issues in the elderly. Vitamin B12 plays a critical role in supporting the nervous system and maintaining healthy red blood cells, both of which directly impact how your legs feel and function. Vitamin B12 is essential for producing the myelin sheath, the protective covering around your nerves that ensures electrical signals from the brain reach your limbs smoothly and efficiently. When your body lacks B12, that communication slows down or becomes erratic. For seniors, this often manifests as weak or unresponsive legs, difficulty with balance, and even frequent stumbles or falls. Unlike muscle weakness, which can sometimes be trained away with exercise, nerve issues require nutritional correction, and B12 is at the heart of that solution. Unfortunately, as people age, their ability to absorb B12 from food significantly decreases. The stomach needs a special protein called intrinsic factor to absorb this vitamin, but this protein tends to decline with age, especially in those with digestive issues, or who have taken antacids or diabetes medications like metformin for many years. Even if you eat meat, dairy, or fortified cereals regularly, it might not be enough. That's why seniors are among the highest risk groups for B12 deficiency, and why so many suffer from avoidable fatigue, leg pain, and nerve discomfort without realizing why. The symptoms of B12 deficiency can be subtle at first, just a bit of tiredness, or the occasional sensation of pins and needles. But over time, they grow into more serious problems like memory loss, confusion, depression, and of course, severe leg weakness. Left untreated, B12 deficiency can lead to permanent nerve damage. But here's the good news, it's also one of the easiest deficiencies to correct. With proper diagnosis and treatment, many seniors experience significant improvement in energy, stability, and mental clarity within weeks. Supplementation can come in many forms: oral pills, sublingual, under the tongue, drops, nasal sprays, or even monthly injections. The method depends on the severity of your deficiency and how well your body absorbs the vitamin. The important thing is to not ignore the signs. If you've been feeling off balance, forgetful, or weak in the legs, ask your doctor to test your B12 levels. It's a simple blood test that can offer life-changing insights. For many older adults, restoring B12 is like turning on the lights in a dark room. Movement becomes smoother. Thoughts become clearer. The world feels easier to navigate again. When your nervous system is functioning properly, your legs don't just move, they move with confidence. You can walk across that living room without fear. You can step onto the porch, down the stairs, or into the garden with assurance. Number 3. Vitamin C, joint and tissue repair. When we think of vitamin C, most people imagine cold remedies, orange juice, and immune support. But vitamin C offers far more than that, especially for seniors. In fact, one of its most critical roles is in tissue repair, particularly for the joints, cartilage, and blood vessels that keep your legs functioning smoothly. As you age, your body becomes more vulnerable to wear and tear, joints stiffen, cartilage thins, and even minor movements can cause inflammation. Without enough vitamin C, your body's ability to repair the damage declines, leaving you with soreness, slower healing, and reduced mobility. Simply put, your legs can't stay strong if the tissue holding them together keeps breaking down. Vitamin C is a key driver in the production of collagen, a protein that acts like the glue that holds your body together. Collagen is found in the skin, tendons, ligaments, and joints. Without sufficient collagen, your knees creak, your tendons weaken, and every step begins to feel like pressure on brittle springs. Maintaining high collagen levels is crucial if you want to walk pain-free, bend without resistance, and keep your stride flexible even into your 90s. And since your body can't produce vitamin C on its own, daily intake becomes a non-negotiable. Another powerful benefit of vitamin C is its anti-inflammatory properties. Chronic inflammation is a hidden enemy in aging bodies. It quietly damages joints and muscles, reduces blood flow, and causes swelling or stiffness, especially in the legs. Vitamin C acts like a natural shield against this inflammation, soothing sore knees and ankles, helping tissues regenerate, and keeping your joints lubricated and mobile. Many seniors find that increasing vitamin C helps reduce their reliance on painkillers or anti-inflammatory medications over time. Beyond tissue repair, vitamin C also supports circulation, which is key to delivering oxygen and nutrients to your legs. Poor circulation can make your feet cold, numb, or heavy. When the blood flow improves, the legs receive what they need to stay energized and responsive. That means faster healing after activity, more stable steps, and less fatigue during the day. Vitamin C helps maintain the integrity of the blood vessel walls, ensuring that they stay strong and flexible as you age. The best part? You can find vitamin C in delicious, natural sources. Oranges, strawberries, bell peppers, kiwis, and broccoli are packed with it. But if your appetite or digestion makes it hard to eat enough fruits and vegetables, supplements are also effective and easy to include in your daily routine. Whether through food or a quality supplement, the goal is consistent intake, because your body uses and loses vitamin C every day. For seniors who deal with arthritis, joint pain, or general soreness in the legs, upping their vitamin C can sometimes feel like adding oil to a rusty machine. Movements become smoother, recovery comes faster, and aches start to fade. It may not reverse years of damage, but it absolutely helps your body cope with and slow further deterioration. Number 4. Vitamin E, the circulation booster. As you grow older, you may notice that your legs often feel heavy, tired, or even numb, especially after sitting or standing for a long time. These sensations are often a sign of poor circulation, and one of the most valuable vitamins for improving blood flow is vitamin E. This fat-soluble vitamin works like a natural lubricant for your circulatory system, helping blood move freely through your arteries and capillaries, ensuring that every cell in your legs receives the oxygen and nutrients it needs to function properly. Vitamin E is best known as an antioxidant, which means it fights off free radicals, those unstable molecules that cause cellular damage and aging. In the context of your legs, that protection means less inflammation, stronger blood vessels, and lower risk of clot formation. For seniors, good circulation is vital. When blood doesn't flow properly, your legs become starved of oxygen. This leads to fatigue, cramping, and even increases the risk of deep vein thrombosis, DVT, and other complications that can lead to immobility. Moreover, vitamin E supports the integrity of red blood cells, allowing them to flow through narrow capillaries without breaking apart. This is especially important for the tiny vessels in your feet, ankles, and calves. Healthy capillaries mean better temperature regulation, improved sensation, and fewer problems with cold feet or swelling. Seniors who take in sufficient vitamin E often notice that their legs feel more alive, responsive, and balanced, especially after prolonged rest. Some studies also suggest that vitamin E helps reduce leg cramps and restless leg syndrome, two frustrating conditions that rob older adults of restful sleep and peaceful relaxation. If you find yourself tossing and turning, stretching your legs endlessly, or waking up with sudden cramps, your body may be signaling a need for better vascular health, and vitamin E could be the missing link. Natural sources of vitamin E include almonds, sunflower seeds, spinach, and avocados. But it can be difficult to get enough from food alone, especially for seniors with restricted diets or digestion issues. That's why many opt for supplements, usually in doses between 100 and 400 IU, depending on their health needs and doctor's guidance. Number 5. Vitamin K, bone support and stability. When you think of strong legs, it's easy to focus on the muscles and joints. However, the true foundation of leg strength lies in your bones. If your bones are fragile, no amount of muscle exercise can prevent falls or fractures. One of the most important vitamins in maintaining bone health, especially as you age, is vitamin K. This lesser-known nutrient plays a crucial role in regulating calcium within the body, ensuring that it is properly deposited in your bones, rather than accumulating in soft tissues like blood vessels. As you age, the balance of calcium in your body shifts. If calcium isn't properly directed to your bones, it can build up in the arteries and organs, contributing to conditions like arteriosclerosis or kidney stones. Vitamin K acts as the key that unlocks the door, ensuring calcium finds its way to where it's needed most, your bones. It does this by activating proteins that promote bone mineralization and preventing calcium from settling in places it shouldn't. For seniors, especially those over 65, osteoporosis, weak and brittle bones, becomes a significant concern. In fact, 1 in 3 women and 1 in 5 men over the age of 50 will experience a fracture due to bone weakness. In these cases, vitamin K can be a game changer. Research has shown that seniors with higher vitamin K levels experience a lower risk of fractures, especially in the hips and spine, areas most vulnerable to breakage in older age. Additionally, vitamin K supports balance and stability. Without strong bones, even standing upright becomes difficult. Your muscles might feel strong, but your bones won't have the structural support to carry you through daily activities. Vitamin K helps prevent bone loss, keeping your legs stable and functional well into your later years. It also works synergistically with vitamin D, which helps the body absorb calcium in the first place. Together, they form an essential partnership in ensuring your legs stay strong and durable. Many seniors, especially those on blood-thinning medications like warfarin, may have concerns about vitamin K because it can interfere with blood clotting. However, this doesn't mean you should avoid it altogether, just consult your healthcare provider about the best dosage for your individual needs. For most people, a balanced intake of vitamin K through food sources or supplements is highly beneficial for bone density and overall leg strength. Number 6. Magnesium, the silent strengthener. Often referred to as the silent strengthener, magnesium is one of the most underrated minerals when it comes to leg health, especially in seniors. Despite its crucial role in muscle function, nerve conduction, and bone strength, magnesium is often overlooked in the conversation about aging healthfully. However, magnesium is deeply intertwined with nearly every process that keeps your legs strong and responsive, making it essential for seniors who wish to remain active and pain-free. Magnesium directly influences muscle contraction and relaxation, which is key to maintaining the tone and endurance of your leg muscles. When you don't have enough magnesium, your muscles become more prone to cramping, stiffness, and fatigue. Magnesium helps regulate calcium levels in the muscles, ensuring they contract and relax smoothly during movement. Without sufficient magnesium, even a short walk can lead to painful cramping or discomfort. And the problem is compounded at night. Many seniors experience restless leg syndrome or nocturnal leg cramps, which interrupt sleep and make it harder to rest and recover. Beyond its role in muscle function, magnesium is essential for bone health. Just like vitamin D and vitamin K, magnesium helps with the absorption and utilization of calcium, keeping your bones strong and resistant to fractures. Magnesium also supports the function of vitamin D and assists in maintaining blood pressure within healthy levels, which contributes to good circulation and reduced risk of heart-related complications. Magnesium is found in a variety of foods, including leafy greens, nuts, seeds, and whole grains. But despite the availability of these foods, many older adults don't get enough magnesium in their diet. Absorption can decrease with age, and certain medications, like diuretics or proton pump inhibitors, can deplete magnesium levels in the body. If you're experiencing leg cramps, muscle spasms, or overall fatigue, magnesium could be the answer. It's easy to supplement and can be taken in various forms: oral tablets, powders, or even topical sprays for direct muscle relief. The recommended daily amount of magnesium for seniors typically ranges between 320 to 420 milligrams, but as always, it's best to consult a healthcare provider before starting any new supplement regimen.